One of our main concerns, of course, is how all of these trends and issues as they develop, how they're going to affect achieving the MDGs by 2015. We're well on our way in many countries, but what we're concerned about is that there may be a lot of backsliding now because of the effect of these trends. We know now that there will be a rise in both the depth and incidence of hunger and malnutrition in a number of countries. And of course, MDG 1, the Millennium Development Goal 1, the most important, which is eradicating extreme hunger and poverty, is going to be affected. MDG 4, reducing child mortality, again, is going to be affected. School attendance will decline. We know that will happen. It's definitely already happening in many countries where the opportunity cost is such where parents are simply keeping their kids at home. They can't even afford the school fees of, or paying for the school uniform or school supplies, and it's more cost effective for them to keep the child at home to assist the family in meeting their basic needs, in many cases food. So MDG 2, which is achieving universal primary health, is affected. Health status will decline. Even those who have access to health care, health clinics and such, to the extent that there is a cost involved, they will obviously step back, and they will see that as being a cost that they can forego until their economic situation improves, and this will affect their health status. They will be less concerned about any type of preventive care, preventive health. There will be increased maternal mortality. We know this will happen as a result, because newly pregnant women, young girls who are often the ones having babies in these very difficult situations, they simply will not. They will even have less access to health care than they had before. And MDG 5, which is improving maternal health, is going to be affected. There's going to be less support for HIV/AIDS nutrition. This is going to be a concern because there will simply be less resources available with the increase in food prices, as long as food is the price of food is denominated in cash and dollars. There will be less of those dollars available out of the aid budgets for these various programs, unless those aid budgets significantly increase and keep up with the increase in food prices and input prices overall, fuel and such. And MDG 6, then, combating HIV/AIDS and malaria, is going to be affected. So we have major concerns. We're losing sleep at night on these issues today. We're going to be able to reach fewer people, and it's going to be, those that we can reach is going to be at a much increased cost. This new face of hunger is emerging in these countries. Many of those who had, you could say, graduated from the bottom billion and we're more moving into a middle class environment will be slipping back to the bottom billion. Access to food supplies are going to be much more unpredictable, in particular in terms of how commercial markets will work. Some farmers in the developing world are going to be planting less for these same reasons. Their inputs that they otherwise depend on are going to become prohibitively expensive. They will simply be able to grow less food. And some policy actions are going to compound the crisis overall, among them the food export restrictions that I mentioned earlier. So overall, we need a coherent global response. And this is, when I say we again, this is all of us involved in these issues. It's governments, UN agencies, international financial institutions, that's mainly the World Bank and the IMF, and NGO partners, the non-governmental organizations, all working together. Immediate and medium term, we have to assess the needs and identify these new vulnerable. Where are they, and how can we best help them? Help countries ramp up existing safety nets where they do exist. Many middle-income countries are well on their way in this regard. Targeting food distributions, the few resources that we may have, we need to look at how we can make them most effective. Policy advice to governments on how best to deal with these situations as they evolve. Balance of payment support, which is again coming from the international finance institutions. Many of our sister agencies will be involved in providing seeds and fertilizer and other inputs, which we have to pay for. But again, the prices are going to be going up. Expanding cash and voucher programs that we do in purchase for progress programs and other programs with countries, middle-income countries and others who have an infrastructure where they can manage cash and voucher programs. And then launch new safety net programs in countries where they're now ready and they have an infrastructure where they can handle these types of programs. Medium and longer term, we're looking at overall policy reform that countries will have to engage in. They have to promote increased agricultural production and invest in sustainable and predictable safety nets. For WFP, as a very large agency and key player in all of these issues, we have to be able to help governments assess vulnerability and meet the urgent needs. In helping them to scale up safety nets for the vulnerable, we will help them target, we'll help them with supplemental feeding programs, the food and cash transfer programs, which I've mentioned, school feeding, and the employment schemes, the food for cash programs, and use a distribution network to support partner agencies as well. This is going to be very important because all of the agencies involved in development programs and humanitarian response are all going to be affected by these issues in a very similar way. This is simply going to be less aid overall available for these programs. We're going to have to be much more effective and efficient in that, with the resources that we do receive. Local purchases to support small farmers, we'll continue with that, and then policy advice to governments again in how to respond